Right. I've had PRP and stem cells into my hip before, and honestly noticed nothing. So I guess I don't really want anything done to my hip per se. I mean, obviously, I would trust your hands and your assessment and your clinical skills, but I honestly think that it's
what was your
nerves and the lumbar plexus.
What was your hip injection done under imaging?
Yes.
Okay, ultrasound or fluoroscopy?
Fluoroscopy.
Okay. I mean, that's definitely something that I always take into consideration in terms of, when we're doing the history is what treatments have you tried and what has not worked. If, for example, if you say, okay, I had no improvement in pain with, a PRP injection inside the hip joint, then that tells me that it's probably not your hip joint proper, the inside of the hip joint, that is contributing to your pain. If, let's say, we end up diagnosing this as a cluneal neuralgia, if you do have advanced arthritis in that hip, it would not hurt you for us to also put whatever we use, whether that's adipose, bone marrow, or PRP, inside that hip as well, while we're already here, as hey, let's see if we can try to change the inflammatory environment of the inside of this hip joint, because that is obviously going to contribute to the progression of the osteoarthritis. So those are always things that we talk about during that appointment, is like, hey, okay, these are the things that I think are going to most help your pain. But from a structural and preventative standpoint, these are the things I would also recommend. And those are always something that some people will say, yep, let's do it. Others are just like, no, well, let's keep costs down a little bit and we'll forego that. And so it's always shared decision making in that sense.